Hello, I'm Sandra Spencer. I'm the Executive Director of the National Federation of Families for Children's Mental Health. The National Federation is a family-run grassroots organization made up primarily of parents and other caregivers who have or are raising children who have serious mental, emotional, or behavioral health challenges. The reason I'm coming to you today is because the National Federation has been one of the groups that's been invited by Vice President Biden's office to come and talk about what we can do around gun prevention and gun violence prevention in our country in the wake of the Newtown shooting. The National Federation of Families has chapters all over the country. We have statewide organizations and we have local chapters who stand ready and able to offer support, training, and education around children's mental health. We are convinced that if children are treated in their home, in their community, and parents get the support they need, that children grow up healthy, they maximize their potential, and that we can make a huge difference in the way our country views mental health. The President of the United States has decided in the wake of the Newtown shooting that he wanted to form a task force to make sure that we handle the issue of gun safety in our schools and for our children. I'm very excited that he decided to not just make this conversation about gun safety, but about improving access to mental health around America. I'm also excited that the National Federation of Families for Children's Mental Health was invited to the White House meeting on gun prevention to talk about what we can do to help parents, young people have better access to mental health services. On Wednesday, January 9th, the Vice President's office convened a meeting of the task force on gun prevention by inviting a group of national mental health advocates to the White House to talk about how to better handle this issue. I'm very excited that the National Federation of Families for Children's Mental Health was included on that meeting. When we arrived at the meeting, much to my surprise, there were only about 12 or 15 invited guests, plus there was a host of White House staff, along with Surgeon General Eric Holder and Secretary Kathleen Sebelius of Health and Human Services. We were all asked to go around the table and talk about what we saw was one of the most important issues and how we really, what kind of solutions that we would recommend around really improving access to children's mental health. One of the comments that I made to the group was that the National Federation was a group of parents and caregivers who have or are raising children with mental health issues, and also the young people who have mental health issues themselves, who have done very great in navigating the systems and really have grown up and able to maximize their potential. One of the points that was very important for everybody to realize is that we cannot continue to link mental health and violence. As a matter of fact, there's no more of a chance of a person with mental health issues creating a violent crime than the normal population. As a matter of fact, most violent crimes are perpetrated against people with mental illness. And so we wanted to first of all make sure that we got rid of some of the stigma and some of the myths around mental health. But most importantly, we wanted to talk to them about the possibilities of what happens when children get the proper support and treatment they need. Also, we stressed the importance of making sure that parents and caregivers are connected with other parents so that they can get all of the support they need, so that they know how to access and where to go to get services and the supports they need. I also pointed out at the meeting that the reason that most parents don't go out and get help for their children is because once they do go out and say that their children has a behavioral or mental health or emotional challenge, then their children are scrutinized, discriminated against, sometimes taken away from them, institutionalized, and none of these practices have proven to help these children get better. So I think that what we need to do in America is to have more conversations about mental illness and how children do recover, children get treatment, children do better. We need to really have more conversations around our country around the importance of normalizing mental health in America. You know, I often talk about what happens in our elementary schools. Children go to school and each year they bring in dentists and they do dental checks for our children. They do vision checks for our children. They send letters home to parents saying, please take your child to the dentist, we found a cavity. We don't have anything like that that normalizes mental illness. We need to make sure that it's a part of our curriculum, that we were talking about it every day, so that if a child feels a bout of depression or that acting out behavior, we are automatically looking at the social and emotional well-being of children, and we are also making sure that there is no repercussion for that child asking to see a school nurse because they may not feel totally emotionally healthy that day. So we were able to bring some of these statements up to the people who were at the meeting. One of the other comments that I made is that I really think that there should be a national outrage because of the number of children we're losing each year to suicide because of their mental illness or their substance use disorders. And I talked about how that every year there are twice as many suicides in our country than there are homicides. And I was very surprised at some of the dignitaries at our meeting who had not ever heard any of these statistics. They did not realize that suicide was impacting so many young people with mental health issues. And so I think one of the most important things we can do is to continue to get this information out there, continue to make sure that all of the lawmakers and people who are making decisions around mental health and other issues hear from parents, hear from young people. And so I made the comment to the group in my closing remarks that whatever decision was made, whatever action was going to be taken in wake of the Newtown shooting, that they were to please make sure that they included the voice of parents and caregivers, and they included the voice of young people themselves, because we really need to be at the table, because we could really tell them firsthand what works for our children, what doesn't work, and children could come together and young people could come together and they could really inform the country around what programs and support and peer networks young people need to be involved in to keep young people safe. Young people will know how to keep their peers safe, how to help their peers when they're in crisis, and how to offer support. But something else I would like to tell you about is what happened after that White House meeting, because there were a lot of people there giving statistics, giving data, giving information. And I felt like Eric Holder and Kathleen Sebelius listened to all of us and really were taking notes so that they could take our comments back to the Vice President, and in turn he could take that information back to President Obama. When the meeting was over, there were staff there of President Obama's and staff from Vice President Biden's office. I was approached by a staffer from Vice President Biden's office who asked me if I would be willing to be further interviewed, because they felt like some of the points I made about listening to parents, listening to young people, and the support that families needed for family-to-family support, that they felt like President Obama and President Biden and Vice President Biden needed to hear some of that information. And so there were only about 3 people from the big general meeting who were asked to come into a second round of interviews. Once we were escorted to another room to do these interviews, it was made a request if I would allow myself to be videotaped. I was very excited about the possibility of being videotaped. One of the things that I was told before giving permission to videotape is that they would be sure that the President and the Vice President will be able to view this video and also be able to use this video for members of Congress in order to make the point. One of the most important points that I wanted to make was that the answer to keeping children safe is never going to be dealing with children with mental health issues by building more institutions, putting children in more residential treatment facilities. Those were not the answers. And so that was important for members of the Vice President's task force and the White House to hear, because what I found out in the meeting was that they were getting a lot of calls and they were getting a lot of public outcry to make sure that children with mental health issues had access to institutions. And so I was able to talk to them about the best way to treat children and to support families is by community-based mental health treatments. Services and programs like Wraparound has been best proven and the best way to help children and families who are dealing with mental health challenges. And so in doing this video and answering the questions by the facilitator, he asked me one very important question at the end of the interview. And he asked me if I could speak directly to President Obama and if I could talk about what I wanted him to know. And I had to step back for a minute because this was a very important question, and sometimes you only get one opportunity to be able to make a kind of comment that you hope that the President of the United States and the Vice President of the United States would hear. And at that very moment, I thought about myself as a parent and my experience and what I went through. And I thought about all the stories of all the parents that we hear every day here in the National Federation, and all the stories that our chapters hear all across the country. And what I wanted them to know is that as a parent who has raised a child with mental health issues, the most important thing, first of all, was for us to deal with the attitude and the stigma that people have in our country about mental illness. And that attitude, that stigma, that discrimination comes from a lack of knowledge, because we are really not having the conversations and the dialogue around the country really about what mental health is. I wanted to also make sure that they did not continue to allow the media to connect mental illness and violence and mental illness with being evil, because those kind of things does not help what we want to do around keeping our children safe, making sure that every child who has a mental health condition gets the treatment that they deserve. Every parent who needs support is able to get that support by being connected to another parent, by being connected to a family-run organization, and that young people get peer-to-peer support as well. So I wanted to look right at President Obama and say that I really hope that he would take leadership as the president to make sure that we had the opportunity to really educate people about mental health, educate people about what it takes to do positive promotion, early intervention, prevention, and what does it take to have excellent treatment, which includes support for families and support for young people. I also want to urge the president to not do anything for families, to do anything to families, but whatever he did, he had to do it with families. We want to be a part of any task force, any commission, any efforts, any solution that was going to deal with mental health issues in America. And so it is my hope that during that video that the President of the United States and the Vice President of the United States will listen to the voice of families, listen to the voice of youth, and contact us. And when he contacts the National Federation, I know that all of our chapters, family members, and youth across the country will stand willing, ready, and able to really help transform mental health care in America.